Dear students, today's topic we will discuss regarding mechanism of local anesthetics. So this is the diagram of the local anesthetics. So you know what is mean by local anesthetics. So there are some physiochemical properties which is important in determining its action. That is partition coefficient and pKa. So these are the two physiochemical properties which plays a important role in its mechanism. So just now we will move to the mechanism of action. So first point is in the nerves the local anesthetics are applied. If it is applied topically, it is going to act on the nerves. Either it is topical application or parenteral application. Parenteral application, if you want to block the impulse in the mixed nerves, okay, so it is going to act on the nervous system. So neuron is the functional unit. In the structure of neuron, you are having, that is, axon, dendrites. Okay, so the drug, for example, the drug, how it produces and exert its action. Okay, so in the neuron, so in the axon you are having sodium channel. Okay, so in the axonal membrane you are having so many channels, but in the sodium channel, if the drug is going to act, and the sodium channel, it has two gates. One is activation gate. Okay, one is activation gate or M gate. So you can write activation gate or M gate. Where it is present, it is extracellularly. Okay, so in the diagram we can see M gate which is present extracellularly, and the inactivation gate, in the inactivation gate is H gate. Okay, so the another name for inactivation gate is H gate, which is present intracellularly. In the resting stage, okay, the activation gate is closed. What is mean by resting stage? Whenever there is no impulse transmission or the generation of action potential, it is in the, normally the gate is closed. When depolarization occurs or when the action potential starts, depolarization occurs. What is meant by depolarization? It is nothing but entry of sodium. So it activates the gate. So from the resting, it is converted into active. So the sodium channel, it exists, or it has two gates, activation gate and inactivation gate. In normal stage, it is closed. Once the depolarization or the generation of action potential occurs, the activated, it gets activated and it allows the sodium entry, or the sodium will enter into the channel. Okay, after few milliseconds, the inactive gate, that is H gates, it is getting activated. Okay, so inactivate gate, it gets activated after few milliseconds and it prevents the entry of sodium, and the nerve cell come back to its resting membrane potential. Okay, so you know what is mean by action potential. Then the nerve cell, it comes back to the resting membrane potential. So this is the normal mechanism which is occurring. Now we'll see. So this is the diagram you have to draw for your exam. So this is the rest. This is the in the neuron you are having axoplasm. Similar to the cell membrane, you are also having the membrane, that is myelin sheath, like this, and resting sodium channel. This is the sodium channel, and it is existing in three stages, that is two gates. In resting stage it is like this, and in activated state it allows the entry of sodium, and in inactivated state the gate sodium channel gate closes and it prevents the entry of sodium. So this is the drugs. In the next slide, we'll see what is the exact mechanism of local anesthetics. So this is the diagram, clear diagram. So this is the local anesthetic receptor. Okay, so here your drug is going to act. This is the local anesthetic drug. This is the unionized form of drug. The same diagram or the whatever I explained before. This is the membrane. This is the channels. This is the receptor, your local anesthetic receptor. This is the sodium channel in resting stage. It is in activated stage. It is in inactivated state. This is the axoplasm. Okay. B is nothing but the drug, local anesthetic drug. It is in unionized form. So the unionized form enters, or it is easy to permeability. It is having higher permeability, or it enters the, or it crosses the cell membrane easily. This is BH. BH is nothing but ionized form of the drug. So the unionized form crosses the membrane easily and it converts into the ionized form. The ionized form of the drug is responsible for its action because it is having higher affinity. So mechanism, we are continuing the mechanism. Local anesthetic receptor is located intracellularly within the sodium channel. So we have seen in the previous diagram. The lipophilic undionized form of the drug penetrates the membrane easily than its ionized form. Okay. Then the ionized form of drug, that is cationic form of drug, binds to local anesthetic receptor and it stabilizes the channel without affecting the resting membrane potential. This is called membrane stabilizing effect. So the drug is going to block the sodium channel without affecting the normal resting membrane potential. This is called the membrane stabilizing effect of local anesthetic.